Turn your head toward my voice, please. Look up. Open your mouth. Stick your tongue out. Tongue up. Tongue down. Face forward, please.
Place your right hand back up by your side. I'm going to continue to pat search on your right side. Do you understand?
Yes.
Tongue up, tongue down. Turn back toward the wall. With your right hand, remove your shirt out from your waistband. Shake it out. Place your arm back out to the side, palm facing me. Take a half step forward toward the wall. Put the back of your hands against the wall. Lift your left foot up toward me. Put your left foot down. Lift your right foot up toward me. Place it down.
How stressed he is at this point. A little tender there. We'll see how well he sleeps and his stress level. Is this one tender? Mm-hmm. A little bit. The heart seems good. Let's check out the lungs. We're showing a little bit of weakness in the lower part of the lungs. Tiny bit. Let's check out the digestive system. Good. The mouth is good. Esophagus, good. Stomach. Tiny weakness in the stomach. Not too bad. Large intestines. Pretty good. So it's more concentrated in his upper digestive system, where we're seeing a little bit of sensitivity from this. Let's check the spleen point where he had some sensitivity. Yep. That goes right along with his tender point, the liver. A little bit. That goes along with the idea of stress that we were just talking about. Kidney. Seems okay. Bladder. Seems okay. Let's check the calm, heat, sleep points.
Fingers on both hands. He's going to let me know if the sensation is sharp or dull.
Sharp. Dull. Dull. Sharp. Dull.
And I'll do this until I have about 5 fingers tested.
range of motion. So Keely, go ahead and bend forward, rounding your back, going down towards your toes. Let your arms just go straight down. What I'm seeing here is this nice curve reversal until I get to right here, kind of at where the low back meets the sacrum. Come on back up. It just doesn't quite round quite as much. So that's an area of interest for me. Put your hands on your hips and extend back for me. So as she extends back, she gets a lot of motion right there at that last segment in her low back. Come back up. And doesn't get a whole lot of extension up above that area. Okay, the other thing that I notice is that her sacrum, her triangle bone, does not want to drop down. Okay, now turn and face here. So now we're going to have you side bend to the left for me, Keely. And as you can notice, there's a hinge point right there. Come on back up with not a lot of motion through above that area, and go to the right. And she actually gets a pretty nice curvature there when she goes to the right. Come on back up. So I'm more interested on that left side there with that. Now I'm going to shear her pelvis off to the left side, and then I'm going to shear her pelvis off to the right side. And whenever I shear her pelvis to the right side, she gets a binding right in these kind of paravertebral low back muscles here. So I'm very interested in that as well. Okay, so that's active range of motion of the
fourth and fifth metacarpal bones. I instruct my patients in clinic to apply the Fire Element AccuStick containing pure essential oils several times per day to activate this point and initiate the healing potential of Heart 8, which is to cool heart fire. This point is specific for heat in the heart, and they can use a counterclockwise motion to stimulate this point with medium pressure if they have time during the day to actually use acupressure. Now, heart heat is going to show as possible insomnia or emotional upset, and if you want to regulate the heart and support the heart, you would probably choose Heart 7 instead of Heart 8. But if you actually have heart heat, then you utilize Heart 8. One way you can possibly see if you have heart heat is to look at your tongue in a mirror and see if the tip of your tongue is redder than other areas, or it's more deeply red than you would expect a normal tongue to look. The healing intention: to activate the body's innate healing wisdom. So an analogy I like to use is when someone breaks their bone, actually breaks a major bone, the body knows how to stitch that bone up, but we use a cast to make sure that the bone heals in a straight line. Healing a broken bone takes the body about 6 months to a year to regenerate that bone. And this is true with chronic health conditions also, that you are simply gently nudging the body and suggesting the healing potential of the body, and it's going to take 6 months or a year to correct chronic health conditions that have taken years to develop, and this includes pain conditions. In clinic, patients also want to know how often throughout the day they
out on another chair, and we should go behind the patient and do a systematic bi-handed palpation on both sides with using all the 10 fingers, and we should go systematically either from the front to the back or from the back to the front, superior to inferior direction. It depends, but the most important is to palpate all the neck levels and also the additional regions. So all the 6 neck levels should be palpated, and we should document if we feel any lumps or bumps in these regions. So level 1 is the submental and submandibular region. Level 2, 3, and 4 are the parajugular regions, which are the upper, middle, and lower parajugulars. we should check the anterior compartment of the neck, which is level 6 with the thyroid gland, and we should also ask the patient to swallow while we palpate this region, and also we should check the level 5 and the supraclavicular region. On the picture you can see that I'm moving the patient's throat side to side. Normally you should feel a crepitation as the posterior edge of the thyroid cartilage bumps along the vertebra of the patient. In case there is a mass lesion or a swelling between the larynx and the vertebra of the patient's neck, then this crepitation is not felt, and the submandibular region collected lymphatic drainage from the facial skin, the eyes, bucca, cheek, the submandibular glands, teeth, gingiva, whereas the submental region collects its lymphatic drainage from the anterior part of the nose, upper and lower lips, mentum, teeth, floor of the mouth in the front,